In today's video, I want to go over cranial adjusting, more specifically cranial facial release. That's a particular technique used by chiropractors to help loosen the bones in the skull and in the face to bring about a certain relief. Now in this video, I want to talk about the benefits of craniofacial release. I also want to talk about the precautions that we need to have or need to take before doing certain sessions, and a little bit about how it works. I did a couple of videos where I did sessions with patients, and you can watch those videos separately. This video, I want to go over specifics about what to expect and what not to expect. Hi, I'm Dr. Michael Craig with Dr. Spine in Bangalore, India. Now, the first thing I want to mention is that the body heals itself. This is the principle in chiropractic that we usually work with the spine. Now, the spine has the spinal cord that goes down from the skull all the way down to the tailbone, and we have nerves coming out from the spine that affect all parts of the body. That is about 20% of the nervous system. The other 80% is in the skull, called the brain. Now, most chiropractors do not adjust the brain because it's very difficult to access, as you can imagine. Some have developed a technique where they're going inside, particularly inside the nose, sometimes inside the mouth, to adjust the facial bones and the skull from inside. These are specific techniques. They're very advanced techniques. I've been certified in craniofacial release, and I've received information from patients that say it helped them greatly. I want to go in this video over some of the things to look for. If you do have a condition that this can treat, it would be very beneficial for you. The first thing to remember is that the body heals itself. As a chiropractor, I don't heal anyone. The body will heal itself. What I do as a chiropractor is remove the interference from the spine, from the nervous system, and in particular from the face and skull to allow the body to normalize or regain its normal balance. Now, craniofacial release works primarily by inserting a balloon, and this seems a little strange, but we insert a balloon into the nasal passages, and there's 6 different passageways where the balloon can go: upper, middle, and lower. And 2 sides of the nose indicate that there are basically 6 nasal passageways where this balloon can go. Once the balloon is inserted, I inflate the balloon, which allows the facial bones to expand, and relief can come as a result of that. This process only lasts 1 or 2 seconds, and then it's over. After that, the patients usually feel a great deal of relief. Now, craniofacial release, otherwise known as CFR, is fairly nonspecific. Now, the condition that craniofacial release can help, in particular, is breathing problems, migraine headaches, sinusitis, or sinus problems, tinnitus, or ringing in the ears, vertigo, or dizziness, Bell's palsy, trigeminal neuralgia, facial pain or paralysis, which can include Bell's palsy and trigeminal neuralgia, sleep apnea, or difficulty sleeping because of breathing problems, snoring, head trauma, PCS or post-concussion syndrome, learning disorders, emotional disorders, and certain neurological disorders. The primary focus of craniofacial release, or any cranial adjusting for that matter, should be the following. Quote, "It is important to note that CFR is not directed at the treatment of any one specific disease or disorder. Its primary objective is to mobilize the cranial bones, unlock cranial fixations, open the breathing passageways, facilitate cerebral spinal fluid flow, increase vascular flow and venous drainage from the cranium, promote endocrine balance, and optimize brain function. This oftentimes improves symptoms related to various structural and neurological disorders." Now, that said, craniofacial release is not advisable if you have the following conditions: if you're hemophiliac, if you're on blood thinners, if you have something called a nasal fistula, if you have or have ever had an aneurysm, if you've had a recent nose fracture within the past 6 weeks, if you've had previous facial surgeries, or surgical plates that cross suture lines, in other words, cross from one cranial bone to another, if you've had severe cranial osteoporosis, if your blood pressure is very high, if you're emotionally unstable, or you can't tolerate anything put inside your nose. Also, if you're allergic to latex, that's another contraindication. In other words, don't do this if you have any of these conditions. Another major contraindication would be choanal atresia. It's a rare anomaly or congenital disorder where the back of the nasal passage, the choana, is blocked, usually by abnormal bony or soft tissue or membranous growth across the back of the nasal fossa during fetal development. In other words, you developed a blockage in the nose at birth or soon thereafter. If you have any of these conditions, we advise against you getting craniofacial release. Now, if you decide to become a craniofacial patient, here's what you can expect. I will need to see you before the cranial sessions. I will have to make sure that your spine is free of subluxations, in other words, the things that chiropractors normally do. So you become a patient, and I will need at least one exam and one treatment beforehand to determine that your spine is in balance or that you are indeed going to benefit from cranial adjusting. Then I'll need to do a cranial examination, a specific examination to determine where the sutures are in the skull, how the face bones are aligned, if there's any irregularities, if there's any asymmetry going on in the face or the skull. Now, after the initial examination, I'll do the treatment. This is on the first visit of craniofacial release. Then I will need to see you every other day for 3 days. All total, it will take about a week. Now, if there's any problems with scheduling, if you're coming from out of town, out of state, or out of the country, I can arrange to see you every day and we can get the treatment done that way. After your treatment, we'll sit down and have a discussion about whether or not any future treatment is needed, whether you need regular chiropractic care, or whether further cranial work is necessary. So thank you very much. I appreciate it. I look forward to seeing you in Whitefield. Check some of the other videos for demonstration of the sessions itself and for any other information that I may have on chiropractic and other conditions that we can treat at Whitefield. Thanks. See you soon.